The Wilbur Downs Fellowship was named after Dr. Wilbur Downs, who was a professor here at the School of Public Health as well as School of Medicine. And it's a fellowship that allows students who have an interest in what we used to call international health and now we call global health to pursue research primarily in low and middle income countries. Downs Fellowship goes way back. I mean, Wilbur Downs and his family were quite sort of pioneers in this field. This goes back to the 1960s. So we've had well over 400 fellows, Downs Fellows, over the last 40 years or so. They start thinking about it in the fall. They identify a topic of interest, a research topic. They start reading the literature, they start talking to faculty. They begin to boil down that topic, narrow it into an actual research question or a hypothesis that they want to test, design the study, get all the necessary approvals, including the human subjects approval from Yale as well as the host institution. And then they go into the field for, again, 2.5 to 3 months. I'm thinking about some of the recent fellows we've had. Sam Diamond, for example, who was a student in our program who just graduated, looked at the Haitian prisons and looked at what happens to the families of Haitian prisoners when often the husbands are detained for prolonged periods of time without any trial. And she looked at the sort of negative consequences on the families. Another student, Ben Sims, also at the School of Public Health, who just graduated, went to Ghana, and he was interested in the intersection between nutrition and hookworm infection, and in particular looking at to what extent nutrition or malnutrition has an impact on treatment of hookworm infection among children in Ghana. So it really varies quite a bit, the kinds of projects that the students do. Over the last few years, we've seen more policy-related projects, more qualitative research, which was not the case maybe 10 or 15 years ago. The student comes to mind is Roland DeMaya. He also at the School of Public Health. He was very interested in the whole notion of human resources for health. In particular, he was interested in the brain drain, nurses leaving Philippines, often for United States or other destination. And he wanted to find out how the Philippine government was dealing with this through their educational policies as well as their labor policies. So students often come back from their Downs Fellowship experience telling us that it was truly a sort of life-changing, transforming experience. They are confronted with challenges beyond the scientific challenges that we often talk about in classroom. They have to deal with some of the cultural differences that they're not used to. They have to deal with logistical issues. So they learn to be global citizens. They learn to live in places that may not have all the resources that we have in the States. So it tends to be a very long-lasting sort of impact on these students, and it changes the way they think about health. We tend to encourage students to go to places that they haven't been before or haven't spent significant amounts of time, just so that they will be challenged in cultural ways as well as in the scientific ways. But once they go into the field, it becomes real. It's now sort of staring them in the face and they need to figure out how to solve a problem. And then they realize the difficulties of doing research in a setting where electricity may not be on all the time, the water may not be on all the time, traffic is even more unpredictable than it is here. There's just a lot of competing issues. So doing research in those kind of settings is very different than in a setting such as here where you have access to the internet, access to the library. So those are some of the lessons that they bring back with them, which is quite unique. And we frankly can't teach some of those things here. It comes from the experience. And that's why we know the value of this, and we're so pleased that we have the funds to support a sizable number of students to do this every year. We've had some impressive publications. I can think of a couple of years ago where a student actually did a study in the border of Iran and Iraq, and that study was published in JAMA, which extremely reputable journal. We're talking about a fellowship about $5,000 for the research cost. It's very unusual for a student-led research, a few $1,000s to be published in a journal of that caliber. So doesn't happen every time, but we certainly like to see that as an example of what students are capable of accomplishing. A lot of faculty mentoring, a lot of hard work, but completely led by this student. So there's a long tradition here. There's a long history of encouraging students to seek these kinds of opportunities beyond their comfort zone, beyond Yale,